Hi, my name is Edward Jacobson. I have a gynecology practice in Greenwich, Connecticut called Greenwich Gynecology with an emphasis on hormone replacement therapy. We recognize that many women have a tremendous need for hormone replacement, for addressing issues of estrogen deficiency, testosterone deficiency, and oftentimes thyroid deficiency. In addition, many people complain of adrenal fatigue and depression and weight gain, and we're here to help you. When I first see a patient, I ask the patient to start telling me a little bit about themselves, what their concerns are, what they're looking for, what they have done in the past, what their past experience has been with hormone replacement therapy, if they've had it before. I also get a dietary history because that's so important, it's easily overlooked because it certainly has an impact, especially with adrenal fatigue. There can be certain amino acid deficiencies in their diet which impact their neurotransmitters. Have to know what type of exercise they do, too much, too little, and also what do they do for stress relief. They just do exercise, they do prayer, they do meditation, they do yoga, and we have to make certain recommendations to make changes along those lines, and that's pretty much just as important as the hormone replacement therapy. We do a fairly comprehensive blood screening, and I tell people have to come back for a second interview or a second consultation in about a week or two to discuss their blood results. And in the meantime, I give them literature to read so they're a little bit more familiar with what the replacement therapy is, and they're more knowledgeable. It makes for a better conversation. Bioidentical hormone replacement, the body sees it as bioidentical, as if it had made it itself. And the concept is to basically replace what has been missing. As one gets older, both men and women, for the most part, most of these hormones tend to diminish in production. And what one tries to do is to bring people back to where they were when they were 20 to 25 years of age, because that confers not only a sense and feeling of youthfulness and addresses many of the symptoms people have, but also backs off the risk for many different types of inflammatory and degenerative diseases. Well, typically, if a woman comes in and has menopausal or perimenopausal symptoms, they're flushes, flashes, night sweats, some weight gain, fatigue, brain fog, real issues, lack of libido, sometimes skin drying, wrinkles in the skin, hair loss. All of these things have to be addressed. So it's really critical when we start off this program to do it in small increments. We want to make sure there are not going to be any adverse side effects like weight gain, bloating, breast tenderness, acne, and so forth from this. And virtually everybody agrees with that. All these hormones in BHRT work in conjunction with each other. They have to be monitored very, very carefully. It's not a matter of just saying, here's a patch and here's a pill, and then I'll see you in a year. It's much more so than that. Estrogen deficiency can cause wrinkles and dryness of skin, and the beauty of replacement is that can really be very, very helpful. We offer a unique product in our office called Collagen, which is a combination of pharmaceutical-grade collagen, hyaluronic acid, and white tea extract, which is very, very unique because it's made to order and it's developed in Japan. Collagen, for the most part, sits as a mask, and it's a large molecule. It doesn't get underneath the skin. But we offer the technology called dermatoelectroporation, or DEP therapy, which is a device that opens water channels in the skin by changing the polarity of the skin, positive and negative polarity, and actually delivers the collagen underneath the skin without needles, without pain, maybe just a little bit of tingling, with an immediate effect, without redness, really augments and complements the estrogen replacement therapy. If you'd like additional information or would like to arrange for a consultation, please visit my website or call our office at 203-869-8353.